A medical assistant may be responsible for performing ear installations in the medical office. An ear installation involves the dropping of a liquid into the external auditory canal. Ear installations are performed to soften impacted cerumen, to combat infection with the use of antibiotic eardrops, and to relieve pain. Medication for the ear is usually dispensed in a flexible plastic container with an attached dropper tip. Begin by sanitizing your hands. Assemble your equipment. You will need disposable gloves, the otic medication, and a gauze pad. Check the drug label 3 times to make sure you have the correct medication. The first time should be when you remove the medication from the shelf. The medication label must bear the word otic or eardrops, which indicates it is for the ear. If it is not labeled as otic or ear medication, it could injure the ear. Check the medication a second time against the physician's instructions. Also check the dosage ordered by the physician. Careful checking is crucial to prevent a medication error. Check the expiration date. Outdated medications may produce undesirable effects and should be discarded. As you will see later in the procedure, the medication label is checked a 3rd time before the cap is removed. Greet your patient and introduce yourself.
Hi, how are you today?
I'm doing good. How about you?
I'm doing wonderful.
Good.
I need to
Identify the patient and explain the procedure and purpose of the installation.
Okay, good. All right, then the doctor would like for me to instill some drops in your ear to help soften some of that earwax that you have built up in your ears. Thank you.
Warm the drops to body temperature by holding the medication container in the palms of your hands for a few minutes. Do not warm the drops by placing them in hot water. If the drops are too cold or too warm, they might stimulate the inner ear, causing the patient to become dizzy. Position the patient into a sitting position. Apply clean disposable gloves. If the medication requires mixing, shake the container well. Check the medication label for the 3rd time and remove the cap. Tilt the patient's head in the direction of the unaffected ear. This allows gravity to help the medication flow into the ear canal. Straighten the external ear canal to permit the medication to reach all areas of the canal. In adults and children over the age of 3, the canal is straightened by pulling the ear upward and backward. In children under the age of 3, straighten the canal by pulling the ear downward and backward. Invert the container and place the tip of the dropper at the opening of the ear canal. Gently squeeze the container and instill the correct number of drops along the side of the canal. The physician has ordered 3 drops of Oro ear drops to soften the cerumen in the patient's right ear. Replace the cap on the container. Instruct the patient to keep her head tilted towards the unaffected side for 2 to 3 minutes. This prevents the medication from running out and allows complete distribution of the medication. The physician may want you to moisten a cotton wick and insert it loosely in the ear canal for 15 minutes. This prevents the medication from running out when the patient sits up. Be sure the wick is moist to prevent the medication from being absorbed by the cotton. Remove your gloves and sanitize your hands. Chart the procedure. Include the date and time, the name and strength of the medication, number of drops instilled, which ears received the installation, any significant observations, and the patient's reaction. Return the medication to its storage location.